A warm good afternoon to one and all. Namaste. I'm Dr. Amrita A, final year MD scholar from Department of Postgraduate Studies in Kajikitsa, Government Ayurveda Medical College, Mysore. I feel delighted and extremely happy to host this virtual event, VRUKKA PRAKARSHA 2023, a national level webinar series on kidney disorders. It is conducted as a part of Golden Jubilee celebrations organized by Department of PG Studies in Kajikitsa, GMC Mysore. Since the past 2 months, our department is organizing national level webinar series. We started our journey of celebrations 2 months back through the national webinar series on cardiology. Now, we are stepping to the second day of National Webinar Series on Kidney Disorders, VRUKKA PRAKARSHA 2023. As everyone knows that kidney disease is called as silent disease because it may have no symptoms in the early stages and thus it cannot be accurately assessed until it is advanced. With this brief introduction, I would like to welcome eminent personality of Ayurveda and our invited guest speaker, Dr. J.L.N. Shastri, CEO, National Medicinal Plants Board, Ministry of Ayush, Government of
I wa-
India,
I wa-
to
I
the
wa-
session.
I was former CEO, not the current CEO.
Please, sir. I also extend my warm welcome to our principal, Dr. Radhakrishna Ramarao sir, and our HOD, Dr. Maitri RC, and HODs and professors from all other departments of JMC Mysore. Last but not the least, I welcome all our viewers who are virtually present in this session. Now, I would like to welcome Dr. Pallavi, first year MD scholar from Department of Postgraduate Studies, to give a brief introduction about the session and to invite our guest speaker. Over to you, Pallavi. Thank you.
And Sri Gurubhyo Namaha. Good afternoon. I extend my warm welcome to all for National Webinar Series on Kidney Disorder, Day 2 of VRUKKA Prakarsha 2023, organized by Department of Kaya Chikitsa on eve of Golden Jubilee celebration. Myself, Dr. Pallavi NM, first year PG scholar, Department of Kaya Chikitsa, Government Ayurveda Medical College, Mysore. It's my honor to introduce today's guest speaker, Dr. Jata Vallabhula Narayana Shastri, sir, with a profound journey in Ayurveda. He holds the present position of co-founder and director at Swastiveda Mumbai and serves as CEO of Jata Herbal Limited in Kakinada. Additionally, he provides guidance as an advisor to Jata's Ayurvedic healthcare system and serves as a chief physician at Ayushman Ayurvedic Center, Kakinada. Dr. J.L.N. Shastri sir past roles include being the former head and executive director at Dabur India Limited and the CEO of NMPB, Government of India, and Director of Dhanvantari Ayurveda College and Hospital, Chandigarh, and Director of Pragati Pharma Private Limited, Hyderabad. His academic qualifications speak volumes with a BMS from Dr. NRS Government Ayurveda College, Vijayawada, and MD in Dravyaguna from Dr. BRKR Government Ayurveda College, Hyderabad, and PhD from Tilak Ayurveda Mahavishwavidyalaya, Pune. Noteworthy accolades include multiple gold and silver medals during his academic journey, as well as the prestigious Charaka International Award for Excellency in Ayurvedic Teachings from AAPNA USA. Sir is a luminary in Ayurvedic literature, having authored over 15 books, published 50 papers in various journals, and contributed over 25 articles. His knowledge is not confined to the written word. He has shared insights through more than 100 guest lectures and numerous radio and TV talks. In the realm of research and innovation, Dr. Shastri sir has filed 11 patents with the 3 granted, covering areas such as natural PDE5 inhibitors, retentions of vitamin C in dried amla, and lipid-lowering products. His vast experience encompasses 15 years in industrial settings, 14 years in government service, and an impressive 34 years in clinical practice. Over 3 decades, he demonstrated expertise in raw materials, medicinal plants, cultivation, extractions, formulations, and regulatory affairs. Moreover, his administrative acumen shines through more than 30 years in various capacities. Active participant in government institutes, Sir has currently holds membership in key subcommittees including new dosage forms in Ayush and and guidelines for IPR on traditional medicines, contributing significantly to the sector's growth. In conclusion, Dr. J.L.N. Shastri sir stands as a beacon in Ayurveda, seamlessly blending traditional wisdom with a contemporary innovation, leaving an indelible mark in the field of Ayurveda. With this brief introduction, I wholeheartedly welcome you, sir, to give lecture on Ravyaguna-based approach in management of kidney disorder. I welcome you, sir. Thank you.
Thank you, Dr. Pallavi, for a kind introduction. I'll share my screen. Hope you are all able to see my screen now. Is the screen visible?
No, sir. Right now it's not visible, sir.
Is it there?
Yes, sir.
Now it will be full screen. Okay. Shall I continue?
Yes, sir. Please, sir.
Yeah, thank you. Thank you. So, a warm afternoon for all of you, and I hope this postprandial lecture definitely is not going to cause sleep for anyone, because the subject is selected for this seminar, or like a discussion, is very important, and a lot of integrated approaches will definitely help people suffering from genitourinary disorders. And the role of Dravyaguna, that's the role of pharmacology when it comes to kidney disease is very valuable. Let it be a dialysis kit, or let it be an aspartic diuretic which has no chemistry behind it, or any other medicine which is essential for management. Okay, so let us look at the problem in a holistic way. Initially, I thought I will not speak about some theoretical part. I'll get into the only the drugs and related aspects, but I thought there should be a proper approach, and this approach should be a combined or integrated approach. Therefore, we can provide better relief in the given topic. So I would like to call my title as the Dravaguna related aspects in Dravaguna related to Vrukka Vikara. Whatever Dravaguna, whether it is basics or applied aspects, let us discuss. Before that, I want to put forward some guidelines for the integrated approach without deviating from the fundamentals of Ayurveda. As Charak and Susut mentioned, Ekam Shastram Adhiyano na Vidyat Shastra Nisyam Tasmat Bahusrutam Shastram Vijaniyat Chikitsakaha. So you should oblige all other faculties of science to really put something new, or at least to put something better than what is existing. And for that, again, they mentioned Vikara Nama Kushlona Jikhriyat Katachana. Many times we try to compare the terms, whether Vrukka is kidney or not, Basti is a urinary system or not. So our entire life or the career will end up in writing 4 or 5 theses on whether Vrukka can be a kidney or not, or vice versa. Instead of that, Vikaranama Kushlana Jihriyatkana, let us not bothered about this thing. Let us look at the fundamentals, let us understand the condition, and then try to manage it on the lines what Ayurveda mentioned, and especially in the gray areas of modern medicine, and turn it into blue area. Therefore, your contribution is palpable for the present set of healthcare. So, Rogamado Parikshat Tatvanantaram Aushadam. You should first examine this condition on the lines of Ayurveda, and then you have to conclude. Otherwise, we take cancer and end up talking about Arbuda, which may not be relevant in a given condition. Okay, so let us first understand, as per the symptomatology, what is this particular condition in Ayurveda, and then start looking at what is this condition in the modern evidence-based medicine, and what edge we have and what contribution we can do. That's the kind of approach. So for that, again, the spirit is yavat kantakata prana tavat karya chikisata. So as we all know, the righteous way of attending to clinics by physician is to just look at the survival of the patient as far as possible, whether it's a bad prognostic or whatever it may be. You should caution the relatives or the friends about the bad prognosis, but you keep fighting against the disease till the last minute. That's the spirit. That's where conditions like chronic kidney diseases, where we are also trying to handle, and those things will be discussed. And then the ultimate thing, Sacheva Bhishram Shreshtaha, Rogabha Pramokshyat, who is the ultimate physician, who alleviates the diseases. He is the Bhishak or the physician. So all these things are aimed at achieving excellence in your practice. Prajnam chikitsardham vishodhyat. You will prune your skills if you keep adding new things, or you keep probing, you keep doing research. So that's the spirit with which we are going to look at the genitourinary disorders. If you look at the overall genitourinary conditions, it's very tough for us to separate reparative conditions from the urinary conditions. The organs are common. So therefore, the usual classification is like only affect people assigned male at birth or female at birth. That's the kind of classification we have. And depending on that, you also talk about benign prostate hyperplasia, or you will talk about ovarian cysts for female, and so on. So even ED is part of this particular aspect. Only thing, the less common but more serious conditions like different kinds of cancer are being omitted for discussion in this particular presentation, though they are part and parcel. Let us talk about the majority where we have some definite role to play. Then looking at cancers, most of them, whether it's prostate or renal or ovarian or cervical, they're all highly metastatic tumors. So when you are also depending upon markers to identify these cancers is very tough. Uh, let us keep this away for the discussion today. Maybe some other day we can discuss. And we all should remember, when we talk about a particular disease, if WHO has already given its the code, that code should prevail. So the codes for different genitourinary systems have been created by WHO, whether it is glomerular disease or tubular interstitial disease, acute kidney failure or chronic kidney failures, urolithiasis, so on and so forth. Okay, even if you look at disorders of breast have become part of this discussion, as I mentioned already about the classification and its importance. Symptoms, they are multiple, as you know. Sometimes a frequency of urination increased, or dribbling, or pain, micturition, and pelvic pain. Okay, there's blood in the urine, and so on and so forth. These are all the symptoms which we come across in a clinical practice, and we need to address while identifying at which level the problem is. Okay, what causes or increases the risk of genital disorders? Is mostly the family history is one thing that's important. The habits like smoking, alcohol, and even diabetes is another one. and frequent attacks of urinary tract infections, and severe stress conditions, and so on and so forth. They're all responsible. And for diagnosis, physical examination to biochemical examination, X-rays, ultrasounds, and cystoscopies, urethroscopes, MRIs, and CT scans, all are available in the modern day. So, how they are treated? Mostly, if you see, even in the modern side, they look at a healthy lifestyle. Please remember this. It's not you and me talking about the health importance of a lifestyle in these conditions. It's the modern medicine which is talking about the first line or the front line treatment. Then for the given infections, mostly they're bacterial infections, you go for antibiotics and antifungal drugs. Mostly these are related to vaginitis and other conditions. And especially Asia and Southeast Asian countries, the vaginitis is a common problem. So that is always associated with the one or other urinary tract infection. When you do the practice in a clinic, you'll come to know all these practical things. What we read in the text will be a little different from what we find on the patient. So standalone conditions you may not get. There may be too many overlaps, and you have to handle all of them simultaneously. And surgical conditions like TURPs and other excisions like phimosis, paraphimosis, which are not there here, but which are there in the Kshuddha Roga for Ayurveda. So, cancer treatments, protocol based chemotherapies, radiotherapies, immunotherapies, they're all part of this. So, if you really want to look at, so you see this right from bladder to urethra and urethra to bladder. See, in Ayurveda, we always have this dilemma. Why Mutrapanam Sosam Vukkovalam Roshnascha Vukkovalam Safascha? But why Mula? Why not Anta? Friends, there is no Anta. If you are starting with a patient who initially had urethritis and later developed cystitis, this is called ascending infection. So your starting point of discussion of this patient and his condition is urethra. Suppose somebody had some cystitis and later developed urethritis, it's a descending infection. Whether it's ascending or descending, whether you start with nephrons, end with urethra, or you start with urethra and end with description of nephrons, for me, as an anatomist, one and same, ascending or descending order. That's the only difference. That's why they never could dare to conclude which is the starting point and which is end. So they said they have given an open end to us. As per our convenience, in a given condition, it is Mula. So the starting point is Mula, wherever you start. So therefore, let us not have any confusion about the Srotas in Ayurveda. There is the same. So symptoms common to this thing already we discussed. And now I would like to put the things in perspective before I get into the drug part. Understanding Vasti. See, Vasti has been mentioned as one of the Trimarmas, and it has been mentioned among the Pranaharmarmas. It has been mentioned as a very important thing. So any condition born in and around or exactly on the organ is going to be a very serious condition, Sadhya Pranaharmarma. Okay, therefore, the bladder cancers, which we always say are highly metastatic, the reason is the disease is in the marma. Therefore, they're all bad prognostic. Okay, just it cannot be 100% generalized. Usually, that will be the approach. If you look at the embryological part of your vrukka, okay, it may not precisely your vrukka, kidney, one and same at some point of time. We say like though vrukka. Vrukka is Kukshi Golaka by Dalhana. That means there is no confusion in the ancient days about this. And in embryological development, it has been mentioned that the essence of Mamsa, Rakta, Kapha, and Medas will result in Vrukka. That's how it has been mentioned. We will discuss at length the scientific part of it. Like when एक गर्भस्य कृत प्लेहाणो सोनित जो when I opened the modern embryology, uh, the development happens from the tissue which forms the blood cells. So that's how the embryology. Same is with even kidneys. If you look at whatever the embryological development mentioned in Ayurveda, you will find a scientific reason for that. Charaka considered Vasti and Vrishna as the Srotomula, just I mentioned it. Okay. And in Patantara, they were quoting that there are manuscripts where Vrukka has been mentioned in place of Vrishna. So, Charasamta Sharira, Charasamta Vimanasthana, this has been quoted. Okay. So, Vasti and Metta as the Shrotomula by Shushruta. And Kati Vrukkaucha, Medo Vahanam Srosam. This is very important. We all know the importance of aldosterone, and we all know the role of suprarenal gland, which manages the fat metabolism, and how beautifully it has been described. Kati Vrukkaucha. So they knew that the main what you call process of fat metabolism is linked with suprarenal gland or the vrukka. Okay. Then Charaka mentioned there are two kidneys we already discussed, and there is basically bladder also along with that, and there are axes like Vrishna, Sefa, and Basti. Okay, Basti Sirashcheva is the terminology given by Shushruta in the Nidanasthana. So, according to Shushruta, two angulis lateral to this Vasti Dwara, or the urethral opening in the bladder trigone, there are two Sukravahanadis, or so called your uh, seminiferous tubules, have been described. And please remember, friends, Tatra with the problem to the Shukrava Shrotas has been mentioned as Shastra Charagrivistada. So, Shastra by karma or Shastra by injury is the question mark. That means the vasectomy was known to them, friends. What is the result of the Shukrava Shroto Dushti? Shandhya. Shandatva has been mentioned. That means this particular your tubectomy and related knowledge was there. We think that they have no clue. If that is not the case, how could he mention that there will be Shandatva? Okay. So this is another thing. Then looking at the Adhokat Dhamnis, which perform the external functions of Vata, Motra, Purusha, Shukra, Artava, etc. They're all separate, they will separate the Mutra, Purusha and Sweda. Please remember the role of Pachikavitta was Rasa, Mala, Mutra, Vivechnat, Pachikaha. And Samanavata is the neurological function, and the metabolic function is Pachikapitta. So all together are responsible for your urine formation. Okay, and the reference directly, indirectly goes to your Purish Dharakala, where a sub-kala has been mentioned by Shushruta. Among the 7 kalas is the Purish Dharakala, which has another kala called Manadhara kala. Yakru Samantat Mundukastam Vibhajate Malam Maladharakala as part of Purish Dharakala. So this trichobilin is first formed and then the urobilinogen is formed. So the stool color is given, then urine color is given by the bilirubin, and then the rest will be settling into your bile juice. So that's how the mechanism has been described. And the portal system, in the context of Maladharakala and in the context of Koshtangas where Unduka has been mentioned, Undukaha Portalaha. Friends, please never say Unduka as appendix. Sushruta is not such a innocent fellow to undifferentiate the Unduka Pucha or your appendix from Unduka. Unduka has been mentioned as having relation with heart towards the right side with liver, and it lies below that. That is called tila. On the left side, it is a pupusa and pliha. Unfortunately, pupusau, that Dvachana was never used in Ayurveda. That means the mediastinal dissection was not done by Sushruta. There is no evidence. There is only one Bhastrika. That's why it was like a blacksmith bladder. It's a single bladder. That means the peritoneal cavity with both the lungs has been described as Bhastrika. So major part is on the left side, therefore they consider the left side. Otherwise, they might have mentioned it on the right side also. So there should be no confusion with that. When we look at Ayurveda anatomy, let us understand as per what is mentioned by the Acharyas. Let us not go by our interpretations. And what is there, what he said is express, Charaka clearly mentioned, Tantrakartura Viprayan. We have to reflect the opinion of the Tantrakarta, not as Jayalin Shastri. I have not mentioned anything related to me. Whatever they have mentioned, I am just repeating it. So, Apanavata is responsible for the excretory function of the Mutra. Sukrata, second Mutra, Garbha Nishkramana Kriyaha. Formation is Samanavata and Apanavata is this. So, whenever we have a particular condition, we should be in a position to collate what is that we are doing and at which level what function is going to be affected by your drug by bypassing the second phase of drug metabolism. Can we stimulate apanavata? Think about it and find out those drugs which will definitely take you to new heights. So that's the kind of thing. And always I'm amazed to read the phrases from Nidanasthana, where the Prameha Nidana was mentioned by Shushruta. Nabhi Pushta Kati Mushka Udavankshana Septa Mekadvara Swantoko Madhyavasti Domaka Vasti Basti Saraseva Paurusho Alabhaya Rupena Srasai Paragaha. Wonderful. He had given the anatomical descriptions. And here Paurusha means Pumchanaha Sishnaha. Please never mention Paurusha as prostate. It was not mentioned in Ayurveda. Let us not claim it. Our approach is different. We mentioned it on the Astila Roga, Mutrastila. We found some mass that in the old days we identified. When our people have not mentioned, why do we want to mention it? Clearly mentioned. Sapha mentioned and Porusha mentioned. That means urethra and penis have been mentioned separately. This is very important. Okay. Ekadvara, what is Ekadvara? It is a very thin muscle layer. Okay, we all know detrusor muscle is there, and then it has single opening through the urethra, and then ekasambandhino heto gudrasti borastito. See, they are all embedded in the pelvic cavity. That's why pelvic pain is one of the important symptoms, and the pain which is born in this particular condition is apanavata related pain. Many cases you may not be in a position to say region wise what kind of pain, but in this case you are definite to mention about the kind of pain. So if you take alabu of this shape, you can show bladder and bladder trigone separately. That's the only thing I wanted to say. Okay, if you take without lobe, then also that's fine. You have depicted the shape of alabu. Okay, mutrashayo maladharaha pranayatana uttamam. Please remember, mutrashayo maladharaha. It may be mala, but pranayatana uttamam. Why in kidney failure you have problem? This is because you have always one third of the blood always circulates to your kidney, and that's why urinary circulation is also very important. Okay. Uh, so pakvase gata nadyaha mutrayanti yada shiraha tarpayanti sada mutran sarita sagaram yatha. Like small canals reaching a big river and then joining the rivers joining the sea is what has been described. We will discuss on that. But pakvase gata nadyo mutrayantu yada shiraha. What happened? Why they pakvase gata nadyaha? I found an interesting publication. Sorry for the distorted letters here. Enhanced large intestinal potassium permeability in end-stage renal disease is the paper published in 2005 and in the Journal of Pathology, and it's from UK Leeds, James University Hospital publication, where it has been categorically established that the potassium secretion and the permeability in the end stage kidney disease depend on the large intestine. And while we read the applied anatomy of the large intestines also in Chaurasia, in the second volume it is clearly mentioned. So Acharyas do possess the knowledge about the large intestines taking the load of the kidney. Amazing. And if you look at these places, do you know what it is? The lower ones are the cross section of the kidney. The upper ones are the river joining the river Ganges joining the Bay of Bengal. There are riverlets. So Sarita Sagaram Yadha, the description given in the calyx having the universe tubules, then going up to nephrons, okay, has a similarity with the rivers joining the sea. So if you make the comparison, you will understand. So सूक्ष्मत्वान् न उपलभ्यन्ते मुखान्यासां सहस्रशः नाडीभिरुपनीतस्य मुत्रस्य आमाशयान्तरात् जागृत स्वप्नस्तेव. See, what they mentioned is whether you are live or you are sleeping, they will be doing this function. निश्चन्देन पूर्यते नवः घटो यदा तदा व्यक्ति वस्तिमुत्रेण पूर्यते. If you dip a new pot up to the neck into water, if you see here, after some time you see some water entering into the pot even without allowing water to come through the mouth. So this nischandana, the osmosis, whatever is happening, and the membrane which is separating this, and at the glomerular level, whatever the exchange of fluids happens and electrolytes and other things, all these things are known in those days, and that has been described. Now, with this background, if you look at the pathophysiology of our Motrava Shroto Dushtikarana is Mutadodaka Bakshastri Sevanat Mutanigrahat Motravahin Dushanti. Satsachara Nistada due to injuries and all. So, the signs and symptoms in our condition are little different because we might not have taken it in those days as chronic renal failure or chronic kidney disease, what we talk about these days. But if you look at Shatkriya Kalas, always this will help you to understand the 5 stages of chronic kidney disease. Okay. See, in the Chaya state, Gunarupa Vriddhi, many times we used to ignore this. In Ayurveda, when excessive froth in urine is considered as a Vata Dushta, we were laughing as students. But when you look at the modern nephrologist cautioning public, do you have excess froth in your urine for more than 2 to 3 weeks? Please consult a nephrologist and get yourself evaluated. So that is the Chaya state. There are so many symptoms. So at that time, if we start focusing, then you will be otherwise. After the Prasara state, slowly the disease is getting established, and for the Sthana Samshaya state, once you cross it, the bad prognosis starts. So either Pururupas or good prognosis, both are possible up to the Sthana Samshaya state. So we should be vigilant. We should look at dosotklesa lakshanas or dosha vriddhi lakshanas in the prasara state, and the gunarupa vriddhi is getting into karmarupa vriddhi and the prakopa state. Maybe at this point the integration should happen, like you have biochemical parameters. Let us look at the urine microalbumin, or let us look at the urine protein itself. Let us look at the kidney function, some parameters, you feel free. You develop a protocol. In my practice, I have a protocol. I'll just share it with you, and you can have, because my observation need not be the final version. You can have your approach, and you can establish, because Vyakti and Bheda are the two stages where disease can be diagnosed, but it will be in a bad prognostic condition. So therefore, at around Stanasansya state only you have to handle it, otherwise it is very tough. But mostly when it comes to these conditions, we go beyond. I just speak about my experiences in, suppose, cystitis, which has been mentioned as Vishnuvata. See, the spectrum of diseases, I conducted a seminar way back in 2001 at Chennai on Mutra Vikaras. I got surprised. If you look at Ayurveda texts and if you categorize, for example, take Mutra Krucha. A urologist whom we invited, he was one of our seniors' husband from a very renowned and reputed hospital in Chennai. He was vaguely mentioning during his introduction that you Ayurveda people consider everything under Motra Krucha and you treat, there are so many conditions and all. So I told him, sir, it's not the case. Even in Ayurveda, we have renal and extra-renal. In the extra-renal, we have gastrointestinal and the gynecological conditions which will result in dysuria. He said, how? I quoted, sir, the conditions like Mutra, Tita and Somaroga, there is difficulty. Though there is excess urination, there is difficulty. And in a condition like, please remember this, in a condition like Kapha Harses, Mutra Kucha has been mentioned as one of the symptoms. Do we remember it? We always by heart the Hutching Sons and other books, but we do not by heart the symptoms mentioned in Ayurveda books. In Kaphaja Harses, that is a rectal cause leading to dysuria. Okay. And look at the 20 Pramehas. The first Prameha is Acham Bahositan Sitan Nirgandhamudakopamam. Acham. There is no turbidity. So, Sarva Sampurna Lakshana Asadhyaha. Why the Kapha Pramehas are Sadhya and the Vata conditions are Asadhya and other is average? Because there the Sarva Sampurna Lakshanatma is not there. Acham Bahositam Sitam. There is no turbidity, only liquid excess urine. Second one is again there is sweetness, so Ikshumehu. Likewise. And there is continuous flow even in the first one and in the last one. Last one is Hastimehi, Hastimati Vajasram, Hastimehi Primehati. So in the Hastimeha also there is continuous flow. If you have ever seen elephant in its mating season when it urinates, I did observe it in the Nehru Zoological Park, Hyderabad, when I was doing my PG, just to understand what was there in the mind of the Acharya. And you can imagine the kind of urine flow you will see during the mating season of this elephant. There is no control, continuous flow. That means there is no narrow control for the bladder of a person who is presenting with Hastimeha. Majjameha and Vasameha. Majjameha, ketone bodies coming from fat source. Vasameha, ketone bodies coming from the muscle source. That's how I categorize. And Madhumeha, anyway, you know. So, if you put them in the right perspective, you will be in a position to handle them. Okay. And all the Pramehas, one way or other, are related to your this urinary system. And not only that, your Vastigata Vata in the Vata Rogas, it is related to this. Okay. So, these conditions are spread in multiple places. In Arses, I just mentioned, in Mutra Krucha, in Mutragata, Who are the authors who mentioned Mutrakucha and Mutraghata? Charak confused us. Rather, we are confused. Why should I say Charak confused us? Charak used both Mutrakucha and Mutraghata as synonymous because he's a physician. Shushruta, being a surgeon, had differentiated Mutrakucha from Mutraghata. That's how I put it. And then Ashmari. Okay, these are spectrum of conditions which are finally leading it to this. And your Dojibanga Klebia, which was mentioned in the Univyapa Chikitsa, is directly indirectly related to genitourinary system. Okay, urologist today he deals erectile dysfunctions. So the overall spectrum in those days also was handled properly. Okay, and the symptoms have been meticulously documented. And if you pick up one by one and then if you look at it, then we will be in actual position to do justice in the clinical practice. Then here I am trying to give you formulations. Anyway, I am going to give you single drugs also. What I have used, I'll tell you. In case of cystitis or recurrent even urinary tract infections, the results are mixed. We will get, you have to pursue it for months together, sometimes 2 months, 3 months also, but definitely you'll succeed. But the patient should really have the patience. What happens, they use one or other antibiotics for quite a good number of days, and by the time they go for a culture sensitivity, they might have used half a dozen antibiotics on average. This is my experience. So whatever you give, the organism which is causing this, usually E. coli you say, and in E. coli also there is a pathogenic strain and non-pathogenic strain. No lab will give you a report on the status of pathogenic non-pathogenicity. Okay, you should insist, and then some of the labs they may, if you have, they have a good microbiologist come pathologist. Okay, so I have picked, that's why I picked up mostly combinations in these conditions. And right now I cannot give you all these things, but the few medicines which I tried and succeeded, I just am mentioning a Vangeshwaras, Aragavardhani, Chandraprabhavati. And Chandraprabhavati in this particular case is having Bakuchi, we prepare it for ourselves. Shadangapaniya, Ushirasva, either of them as Anupana. And Karpura Shilajata. In the other parts of the country, whatever we are selling as Godanti Bhasam today is nothing but Karpura Shilajat mentioned in Rasa Samachaya. Godanti is not Kashaya Rasa. This particular Godanti Bhasma available is Madhur Rasa. Godanti should be Tikta Rasa. So I've collected some samples. These samples must be with the PG department of Hyderabad. I've given the samples which I collected way back in '86 when I went to a tour to Yogi Pharmacy. I collected it there. Like Godanti is like Godanta, small white stones, and their basma will be very bitter. So Karpur Shilajit is abundantly used in South India, both by Ayurvedic physicians and Siddha physicians. And these are few things which will really help you. In BPH, as I mentioned, usually we look at the cancer markers, the prostate-specific antigens, PSA, and always it should be below 5. Above 5 gives a suspicion, and we will monitor them. And if it's malignant, it increases 100 folds every time. So if not the case, we can give symptomatic treatment. Many times TERP may not be the solution, or recurrence is something which will discourage many subjects for going into surgical procedures. And sometimes because of the old age and their diabetes or related hypertension, other conditions, they may not be subjected to any surgical procedure. Then also they need relief. So, as single drugs here you can try, because in a other case, as I mentioned in cystitis, I was not using single herbs with success, so I don't talk about it. But in case of your BPH, you can definitely try camphor also individually. I mean, and then Shilajit individually, Google individually, they all give good results. the nocturnal micturition is increased because of the irritation. So there we can. Out of 5 lobes, usually the lateral lobes, if they are enlarged beyond 5 centimeters only, they put pressure, and then they will have urine symptoms and all. Or if the middle lobe is enlarged beyond 4 centimeters, then it puts pressure on the urethra and there is irritation. So these are the people who show some of the clinical symptoms. Otherwise, they are not. But my success comes from formulations, only 2 formulations. I don't use much. Arogyavardhani and Chandraprabhavati, and 500 milligrams thrice daily, or 1 gram thrice daily, each one. So depending upon the condition. So I make it very simple so that they will. And any serious condition, as you know, tata dhanvantriyanam adhikaraha, likewise we refer to patients. While selecting those cases itself, we should be very careful what we are doing. And as I was mentioning, there are conditions like Mutraatita and Somaroga in the gynecological category, where mostly the Pushani Churna, Amalke B Churna, Bimbi Mul Churna. Actually, Bimbi Mul Churna is very bitter. I don't know how many of you might have ever tasted it. In the villages, if you get one creeper, the root will be sufficient for the next 6 months. They have large roots and bulky roots, but the powder is very bitter, and its uh, juice has been recommended in bedwetting by Shaya Mutra, by Sarangdhara. Shaya Mutra Vinasa Bimbi Mula Bhavorasaha. Hyphena Prayogopi Sadhyobadashta Palapradaha. So Hyphena is also mentioned for that. But anyway, Bimbi Mula is useful in these conditions. And then I want to enumerate the subject proper. Once you understood different aspects of anatomy and physiology, on which basis they have developed a section of drugs or the single herbs. Mutra Virechniya Dashemani. This Mutra Virechniya Dashemani is different from Shodhar Dashemani, friends. Shodhar Dashemani are Dashmulas. Mutra Virechniya Dashemani, except Ketaki, if my memory goes correct, please correct me if I'm wrong. All are graminae, all the grasses. Only one Ketaki. Okay. So very interesting. 9 from one family and only 1 from Pendanesi. What prompted them to do that, I have no clue. But one is diuretic, clearly diuretic, and the other one is Sotahardashemani. Sotahardashemani is not a diuretic. Many times we do this blunder. If you look at Punarnava Shodhagni, Punarnava, Rakta Punarnava, the commenters were, that means Sweta Punarnava and Rakta Punarnava. That means Rakta Punarnava is the second Punarnava which has been introduced contemporarily by Charak only, because he mentioned both. But he mentioned Shodhagni, that means which is the Sweta Punarnava, Trianthema. It is anti-inflammatory, but we call it as Mutrala. It's very unfortunate. Please understand. In case of urethritis, when there is no relief, you are not giving anti-inflammatory drugs. You are giving a steroid. Okay. The steroid will act on the smooth muscle and reduces the inflammation. Till such time, the patient was feeling burning micturition or difficulty in micturition. All of a sudden, since the soft tissue inflammation has come down, the patient will find a relief and he will say, now I don't have burning micturition. Immediately, we innocently started claiming it as Mutrala, without looking at whether it is a Mutravardhana or not, whether it increased the volumes of urine or not. We have simply started saying that the Punarnava is Mutrala. And to confuse us, Borrelia diffusa, when it was studied in animals, has shown diuretic activity also. The worsened our approach, worsened our approaches. Okay, we are now in dilemma. Day in, day out, wherever we meet, we keep fighting with each other to decide whether Sweta Punarnava is the right Punarnava, Rakta Punarnava right Punarnava. Industry unfortunately will support you in Rakta Punarnava because it is bulky, available everywhere. Sweta Punarnava roots are very small, though it can be cultivated in few days. Every fortnight you can harvest and you can get Sweta Punarnava roots. The leaf is used as vegetable in many parts of the country, so that the root is used by you and leaf is used in leafy vegetables. So we should really look at it. And this has beta and alpha cytosterols. So these cytosterols have similar activity of the steroids. Therefore, whenever you have given Sweta Punarnava Shothakani to urethritis, the patient has complained relief like the other steroidal agent. Okay, because of the similarity to the steroidal compound. And this relief has been misinterpreted as a diuretic. Relief from difficulty in maturation need not be diuretic. And if we don't have that clarity, we continue this mistake for generations together. So, friends, my suggestion to all of the audience is show constraint. And you take Hemadri's commentary. Among the 63 different combinations of rasas, he mentioned Punarnava as Chaturvidh Rasa Sammelana, the combination permutations. 6 rasas combination permutation becomes 63. So, for Chatuh rasas, Katu Tikta Kashai Madhur Rasa combination is Punarnava. The example given by him is Punarnava. None other than Hemadri gave this kind of clarity on Rasa Sankhya and with examples. Okay. So it is Vishnabhidya Kaduvipaka. There is no Prabhavajana Karma written anywhere. So even if to escape, we say Prabhavajana Karma, even that scope is not given by the text. So on which basis we are claiming? Rasaguna Vidvipaka, Baddha Venmutra is Kaduvipaka. Vishnabhidya is also Baddha Venmutra. So on which basis we are claiming? It is not Mutrala. It is only Sodhara. But Sodhara can also give relief from Mutra Kruchra. So we should. And Mutra Sangrahani Dasyamani, if you look at Mutra Sangrahani Dasyamani, this Dasyamani to be used in diabetes. Nowhere you get the mango seed kernel, Amra Bija Asti, in the diabetes. But if you look at mangiferin related research, it has gamma PPR activity, and IH82 of our CCRAS contains the Amrabijasti. In some pockets of Orissa, they collect this seed kernel and they sell it. It's a very good quality. And when we studied in the animals, we identified that as it has a similar activity like your sitagliptin and all. So very powerful anti-diabetic. But where it has been mentioned, only in the Mutra Sangrahani Dasyamani. When there is Bahumutra, you have to give Sangrahana. When there is turbidity, Avilatva, you have to give Mutra Virajaniya. Very simple. My principles are very simple in practice. Since I could not read more about Ayurveda, I have taken simple approaches. Therefore, I am successful, whichever I touched clinically. So, the fundamentals are to be there and they are to be used. Okay, so that's the thing. When it comes to Shushruta, again, Shushruta had given different categories and his ganas like Veeratarvadi, Mushkakadi, Varunadi, Ambashtakadi. Friends, I am going to show you the fun about Varunadikwada, like Patoladikwada. Varunadikwadas are n number. Okay, none of them have been indicated for any specifically for any renal conditions. It is for Gulma, it can Vidradi, and so on. I'll show you. I'm not. Veerataravadi has been mentioned, repeated. Mushkakadi has been mentioned. Okay, and Ambastadi to an extent. So, if we can, Bruhatyadi, I forgot another one. It's not Ambastadi, the Bruhatyadi. So, between Bruhatyadi, Veerataravadi, Mushkakadi, Mutrakuchra, Mutragata, Ashmari, Mutrakuchra, Ashmari, Mutrakuchra, Mutragata, all indications. So, Wherever there is obstruction, what to be done? Wherever there is a difficulty in micturition, what to be done? When both are present, what to be done? Both are present along with the stone to be addressed, what to be done? So they created these groups in such a wonderful way. But we find repeatedly one prescription, Varnadikada, 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 without understanding what Varnadikada we are prescribing. Sorry for saying this, I will prove my point. So, the concepts in the medieval and modern periods, if you look at, Sarangdhara's groups are there. Even you can pick up some of them from them, like Bhedana, to be taken. Please don't attribute Sarangdhara's the karma to only gastrointestinal. He never mentioned like that. He just mentioned that anything which is broken is Vedana. Anulomana, wherever there is renal colic, you need to do some anulomana. So for that you require this group. Wherever there is a growth, small or big, you either need to do lekhana or chedana or both. So I just have enumerated two things, renal cyst or renal polyps. Okay. Deepanapachana. Deepanapachana is essential for urine. That's why I was mentioning Pachaka Rasamala Motra Vivetnat Pachakaha. Okay. So for the formation, actually you have to maintain proper Pachaka Pitta. For that, what is to be given, that is also important. When you look at Acharya Privesh Sharma ji, he mentions two, three important things like Motra Buddhikara, Motra Kshekara, and herbs which have a comprehensive active on Motrabhasrotas. Very simple but still very effective. Like Palandu, Gokshuda, Yusira, and then Udisha. These are all things for Motra Uddikaras, Motra Kshekaras, Ashwatha, Asana, Jambu, Dhava, etc. Then if you look at common herbs which are used in Motrabhasrotas as such, Pashana Bhed, Varuna, Gokshuda, Kulutha, etc. Okay, so one of the approach you can have, but my experiences when it comes to renal calculi, since I mentioned about the Bhedana, there, if the renal calculi, there are three: renal, urethral, and vesicular. Renal calculi, if it is present in the upper or mid pole, even up to 18 mm, that's rare, but even up to 18 mm we've seen, they've been brought out, and I can share my experiences with evidence. There's nothing secret. Okay, and if it is in the lower pole, even if it is 8 mm, it is very tough to bring it out. And in my observation, I never required a ultrasonogram for the clinical symptomatology. As a thumb rule, a patient having more than 4 mm calculus will only complain of some or other the symptom sign of the renal calculus. This is very significant. Okay. And the urethral vesicular calculi are manageable with Chandra Bhavati. Again, I mentioned with Bakuchi and Karpur Shilad Bhasma. This is how I use. Sometimes I give Kulutta Kashaya alone, sometimes without Kulutta Kashaya also I give. And sometimes I give Kulutta Kashaya as Anupana to the medicine. Okay. So I am coming to the last part of my discussion. So we are coming to complete 50 minutes now. I'll take another 4 or 5 minutes and conclude. By chance, I started dealing with CKDs under compulsion for various reasons. I cannot enumerate those conditions, but I started looking at it very seriously. In the initial phases, I was questioning myself, why should I touch when the symptoms are not there? One in ultrasonogram showing a renal parenchymal damage with or without changes in the renal profile. Uh, so why should I actually look at the patient? It is like hepatitis B positive patients coming to us for treatment without even developing any kind of problem related to liver. But still, sometimes you have to, and that's how we started working. So I have documented more than 100 cases till date. There may be more number of cases, but Managing it for beyond 5 years is one thing where I will report the case. Otherwise, I can say there are into thousands. But those who have used it for about 5 years is what I'll be reporting, because the latent period required for progression from one stage to another stage itself is 5 to 7 years in many cases. So there you may be wrongly claiming some success, or there may be real success also. So for that you should have a specific approach, and that's what I am going to discuss here. The chronic kidney disease is known. I will skip these slides. I will share it with you, and you can look at it. There are 5 stages, as you know, depending upon the GFR. And then acute renal failure is to be differentiated as a pre-renal, intrarenal, or post-renal. Chronic renal failure is because of the insufficiency of fluids, and then there is edema. You have to handle the GFR. Then there will be anemia because the suprarenal gland stops functioning, and the hemopoiesis doesn't happen the way it has to happen. The BP will be increased. That's hypertension. Then you have a lot of weakness and fatigue, loss of appetite. When there is an increase in serum creatinine beyond 3 or 4 mg%, usually there is a lot of the loss of appetite. And in female, this appears little early, because for female, as a dictum, we say the creatinine should be ideally less than 1. So these are the things. Okay, the outcome is there is a lot of increased risk, which leads to damage and reduction in the glomerular filtration rate, then ultimately leads to kidney failure and finally death if dialysis also doesn't work. Okay, and various lab investigations are there. You're all aware of that. And why is it important? And there are several studies which have established that this particular creatinine evaluation is definitely going to help the clinician in understanding the progression of the stage from months to another one. EGFR, today you have online counter. Just you can type the recent creatinine value and the age, then you will get the risk factor. Okay, but once you have some or other kind of ultrasonogram changes indicating there is a renal parenchymal damage, whatever the damage it is, they will have a problem. Rest of them, they usually recover as we observe. And these are the 5 stages, depending upon the severity and the therapy to be given. 90 is the ideal one. Anything above that, people may not have any problem. Okay, and then mild and moderate GFRs have been mentioned as below 90 and below 60. So then they go for the dialysis, as we all know, hemodialysis or peritoneal dialysis. You must be aware. Okay, only thing you use this membrane to just filter the unwanted things and send the wanted electrolytes into the system and to keep the patient live. So when actually I was working on this, I reviewed, and that's why I have not shown any of the new studies, right from 69 to 92, whatever was there, because I touched this case for the first time in 1998, and that was referred by one of our senior doctors from Hyderabad. And since then, I slowly started looking at the chronic kidney diseases also, and I realized there's a lot of scope, and there are at least 50, 60 cases which have responded very well, and they're doing well. Like if it is stage 1 and 2, the patients claim they're cured. I never used it since they don't have any symptom again for more than 7 years and 8 years. They claim that they are cured. But I say I want to follow it up. And most of the patients will again come to me if they have a problem, because when we started treatment, they were all advised one way or other dialysis. They wanted to avoid dialysis, and that's how they come to us. But let us not do heroics here. Let us assess them properly. If we are confident that you can reverse, the condition to some extent, you can. And my treatment very simple. I give 1 to 4 tablets of septilin. I'm sorry, Neurosil, which is nothing but Bhumi Amla extract, Philanthus amaris aqueous extract, 1 gram capsules. So this is something which is coming from Solomix, and is the only company which is ritually manufacturing these tablets, and I never use it for liver disorders because I did not find single reference from classical Ayurveda literature on Bhumi Amlaka either in Pandu or Kamala. So I keep it aside, and it's my regular prescription for this and for the respiratory problems. Please look at Charaka Dashayamani. Dashayamani, Swasaharani, Dashayamani, Kasaharani. The common drug is Bhumi Amlaki. It is Bhava Mishra who added the new indication, that is Prameha, to Bhumi Amlaki. I am considering this as Prameha because there is a Prabhuta and Avilatva. So I started treating it as Prameha, where I got the reference from Dr. V.V. Ram Shastri, who did his MD thesis on Bhumi Amla in diabetes. So I started working on this, and it is giving very good results for us. Okay. So as I already mentioned, the condition is to be handled at the Pururupa state. Okay. So like all other people, I also used Panarama Mandur, Gokshara Gugulu, Paranasava, Chandaprabhavati with camphor and this Motra Vedach and Chorna, etc. But after developing this regime, prescription regime, I started getting results. Like the first part is for about almost 17 years, from 1990 to 2007, where we have gained Neurosil along with Varnadikwada. Friends, I was mentioning about Varnadikwada. I will show you the difference in Varnadikwada. All of you are innocently prescribing Varnadikwada thinking it is one and same. There are several references. Each company will be manufacturing with different ingredient. So we should be sure about what kind of Varnadikwada. Like I'm giving some examples which I tried. Each one is different. So how can you standardize? So you should be clear about what Varnadikwada. And Varnadikwadam Kafam Medo Mandagni Magnatun Niyachati. Okay, Adhyavatam Shiraschulam, Gulbam, okay, and Antah Vidradhi. See, these are the indications. So we should be clear that this is not precise to the genitourinary system, or it is not precise to the urolithosis, but unfortunately people just prescribe blindly Varnadikada, Varnadikashayam into the renal calculi. Okay, so think about it. Is my observation, and I documented the creatinine levels in the subjects whom I treat. Okay, blood urea levels, and then children, male versus female, okay, creatinine levels. And part 2 we started in 2017 and document of 2014, the active days of my practice, and now I have half a dozen cases. Bhumi Amalki, and I replaced with Guduchi. For one reason, I was trying for a simple rasayana which I can try. So I found Guduchi and I'm continuing. Uh, and people can question me. I may not give a satisfactory answer to any one of you, but I thought it when R.S. Singh and others have worked on good regenerators. So I also thought some regenerator to be given rasayana drug. So none other than Giloy for me was found to be a rasayan to be given in this case, and there is no other logic behind it, but it is giving very good results for me. Okay, if you see, there is a statistically significant improvement uh, in the treated group, and it's an observational study which I published earlier also. And GFR to be calculated. Now you have online EGFR calculation facility. Okay, you can do it successfully. So I am coming to the last slide in my presentation. rest is open for discussion. Anyone wants to question, I'm open for that. The most important 5 things you should remember. These are the common mistakes. I was doing the same mistake as a student, so therefore I have every right to tell my experiences. Ashpuri and Gorochana are by mistake considered the same. Many people, scholars have written Pittashmari. Are Baba Pittashmari in Vasti. Kremeda Pitteshva Rochana Goho. In the Pittasya, how the Gorochana forms in the similar fashion in Basti, Ashmari will form, is the Samprapti given in the text. So there is no scope for confusion. So the Gopitta, which is nothing other than Gorochana, is something. And I treat with this Gorochana Dvati, I regularly treat the post-cholecystectomy syndrome. Because after cholecystectomy, majority of the patients will develop the symptoms of indigestion and everything, and their fat is not hydrolyzed because there is no sufficient bile coming into their system. So if you give a Gorochana Dvati along with meal, there will be no problem, and I have done it in 3-4 cases. You can also try, but there is clear difference between this gallbladder stone and the urolithiasis. Please don't confuse. Paurusha is not prostate gland. Paurusha is urethra. Punarnava, especially the Shweta Punarnava, is Boreava diffusa and Sodagni, not Botrala. Excess intake of water is blindly recommended without understanding Prakriti. This is another important thing. I always felt if I have to drink water according to Ayurveda, probably I may not be in a position to drink water at all in my lifetime. If you take it before water, before food, you will be krusha. If you take it after food, you will be stula. If you take it along with food, it will cause amadosha. Don't take cool water early in the morning. If at all you have to take lukewarm water. So such kind of restrictions are there for water usage. Water taken in the other desha is not to be taken in the new desha. This is another problem in the modern era. Okay, so like this is adharani vega. Okay, Trishna is adharani vega. Definitely your body will ask how much water is required at what time it is required. It will ask. You need not put 3 liters and 5 liters and keep drinking. If you are sitting in an AC room and take more water, it is also wrong because your body is not sweating and you are unnecessarily loading more water. Okay, so think about it, and as per necessity, water can be taken. You need not insist 5 liters, 10 liters, and all those stuff. It is not there. Then the renal failure is a symptom-free stage till almost stage 3. Many times there are no symptoms, but we are treating many times as vrukka, and it is not vrukka alone. Okay, it has different ramifications. Therefore, the theory, whatever I have mentioned earlier, that is to be taken coupled with this, and the medicines are to be taken up, designed, and to be given. Whether it is a hypertensive kidney disease, whether it is a diabetic nephropathy, okay, whether it is autoimmune kidney disease, whether it is an acute infection leading to acute failure. In Chandigarh, I have seen when we referred this boy to PGI Chandigarh, HK Singh said nobody can save him. We were doing a ED study with him at that time, therefore I discussed. But today, boy is live, and we could survive him for about 8 years or so. We started the treatment when he was 8 years, and in the age of 16, when the kidney was adult size, we have gone for a transplantation. Afterwards, of course, I have not followed up, but the boy survived 8 years with simple Giloy Sattva and Bhumi Amla. Okay, so you make a plan and follow the principles of Ayurveda add modern knowledge to it, and without giving any kind of wrong, what do you call, claims, and if possible with support of a nephrologist, if we can establish nothing like that, and we will definitely add more life to the people. Recurrent infections, I have seen several cases where add-on therapy has given earlier relief to them from infections. So wherever it is necessary, let us have that integration, and this is a very important thing. And there are many more herbs. More than talking about the herbs, I wanted to give the basic concept. Now the herbs are plenty. When you use next time gokshura, you should be clear for what you are giving it. That's the kind of approach you should have, whether it is the complete package for urinary problems and genitourinary problems, for which gokshura has been mentioned, vrishya vataharanam. So let us be uh, focused on these kind of herbs, and establish we can come out with a drug or multiple drugs which are cheap and effective, and at the same time they will address the gray areas in the modern medicine. So with this, I stop myself here. I thank the organizers, especially Dr. Sanjay and others, the students who have given me an opportunity to interact with a larger audience. And let me conclude and confess, I am an immature and amateur Ayurvedic practitioner. So I keep updating myself, and your research inputs, if they help me in further pruning my skills in my practice or my research, I am ready, I am open. Please let me know, and together we can do something good for the suffering humankind. Thank you, one and all.
Thanks a lot, sir, for a very wonderful and informative session. Your sessions on understanding of the urinary tract disorders as well as on Basti with comparison of Bay of Bengal, Hastimeha, and Mudport was really informative. And it is a very new things that we came across, and by thinking about the Virechana, Upaka, Mutra Virechaniya Dravyas and Mutra Virechaniyas, and as well as Shodhahara, it is actually a new kind of concept that could ignite many minds in Ayurveda. And now I would like to say that the session is open for questions. If anybody is having doubt, you please could comment in the chat box.
Simple questions. You are speaking to a poor student who is entering into 60th year. So questions should be very considerative.
There are some questions already being posted. So, over to you.
Yeah, there is a IgA nephropathy. Actually, I was mentioning autoimmune kidney disease is on the rise. Like many autoimmune conditions, even long COVID, friends, this is very apt occasion. If people look at WHO website and what it is doing on long COVID, those who are either vaccinated or have suffered from COVID, they are developing multiple these things. Number one, neurological. Number two, GIT. Number three, even renal. So I think there is very little is done on the autoimmune kidney disease. My suggestion always is, see, autoimmunity is Ojo Vishransa. Please read Hamadri and Arunadatha, not Arunadatha, Hamadri and Ojo's context. He questioned himself. He is the only person in the history who could dare to challenge the acharyas, earlier acharyas. He said, Marana Mitita Kshaye. When there is Ojo Kshaya, there is Marana. So it is immunocompromisation. So prior to that, there is a stage called one is immunodeficiency death, immunocompromisation. Prior to that, autoimmunity. See, the autoimmunity is your body has forgotten to protect you. and with a specific response. So you can look at it, and it is Ojo Vishodhana. Dalhana says for this Vishransa, Ojo Vishodhana is the treatment. Please go through the Dalhana commentary and Shatkriya Kala. We ignore it. Till date, last 30 years I am searching, I could not find any reference about Ojo Vishodhana. If you come across in any text, any form, any bold new author who described or discussed about Ojo Vishodhana, take it and apply it on all autoimmune diseases. Okay. Now, since I've handled 2-3 conditions only, it will be unfair for me to comment, but definitely I'll tell you. I have a very peculiar approach for autoimmune conditions. I succeeded. Therefore, here also I am using the same. I use Simhanada Gugulu. Okay. Simhanada Gugulu, formula is very simple. Na? Triphala, your Gugulu, then Gandhaka, nothing else. And there's another formula also, lengthy formula. I don't use it. Therefore, out of context for me. Okay. Shwasam Sudurjayam Hanti Kashan Panchavidhan Tada. Apart from Amavata, Amavata Gajindrista, these slokas are all known to everybody. But mainly the Palashruti says, Jain, sorry, Swasam Sudurjayam Hanti, Kashan Panchavidantada. These are autoimmune conditions. Your Vatarakta SLE is an autoimmune condition, Amavata autoimmune, your asthma autoimmune. So I have given it in other autoimmune conditions also. So it was showing very encouraging results, and the patients are becoming symptomless at least. In sarcoidosis, about 6 cases I treated, and 5 reported back, and they claim themselves they are cured. One patient is still using, she's in Chandigarh. Last about 12 years she's using, not 12 years, 16 years she's using Singanar Gugulu. She says she is fine, and there is no progression in the last 16 years for the uh, sarcoidosis. Other patients, 4 patients claim that they are cured. I don't say. They themselves declare they are alive and cured. One patient passed away due to her bronchial asthma, not bronchial asthma. Uh, she was suffering from bronchial asthma when we are given. She had developed a complication, passed away. The rest of them are all surviving. That shows that the Singanar Gugulu as a formula, because I want to be successful in a simple way. The drug should be simple, cheap, and easily available to the patient is the dictum of pharmacology. We being Dravaguna specialists should look at it. Very simple formulation, definite formulation. Please try this. Any autoimmune condition, why not? Why only this particular nephropathy? Think about it. That's how I look at it. It is Ojo Vishransha. Autoimmune is Ojo Vishransha. So either Vyapata or Ojo Vishransha. And he explained, if it is not Kshena Jahati Swanlingam, or if it is not Vruddhi, there will be no symptom. So Vikruta Rupa Vojo Vruddhi is autoimmunity. The Vikruta Rupa Vojo Vruddhi discussed by Hemadri, something prompted me to look at autoimmunity in 2005 at Delhi CCRA's conference. I have given my paper on Vojo Vruddhi as autoimmunity. So I can share that with you. On this you can develop further, and I have given some solutions for autoimmunity there. And you may question why one drug, sir, how fair it is. Are they are giving prednisolone for everything? Develop one prednisolone, that is seminar Google for me. Yeah.
So this is the next question, sir.
Uh, Kindly explain nephrotic syndrome approach to. Again, it falls between Shodha. Okay. Sarvadeha Sarasodha Sakrucha Sannipatikaha. Always I put nephrotic syndrome as Sannipatika Sodha. Okay, it started with Pandu. Okay, and then your glomerulonephropathies, whatever you say, they're all part of it. Okay. So these are the conditions where you need effective antibiotics to start with. If it is due to an infection, if it is glomerular nephropathy, if it is otherwise, it might have started with even simple anemia. Okay. So Ayurveda has given it their limitations. So very early in my practice, I was looking at it, and ever since I realized it is Sannipatika Shodha, I never wanted to treat it, and I never treated it. Though I've heard many people successfully treating them, I have my own doubts, and I cross my fingers even when they claim, because I can't ignore acharyas. It must be some other condition, but definitely it is not Sannipat Shodha. But I consider Sannipatik Shodha. Yeah, as I told you, I am giving for this CKD stage 1 and 2, people have survived beyond 10 years without any kind of derangement, even in the biochemical parameter. Okay, I can share the data for anybody's interest. I give Bhumi Amla 1 gram extract to 4 gram extracts, and it is given for 3 times daily. I don't add anything. Initially, I was using Punanava, Mandur, whatnot, everything. Now my prescription is very simple. I will write down on piece of paper when they come next time, following the advices which we have given. Invariably, their creatinine and urea levels are what I have mentioned. Therefore, make it simple. Give Bhumi Amla and Giloy Sato. Giloy Sato, we get it prepared here from a place called Tuni, Bhogalingeshwar Ayurveda Tuni, and that alone I am using. In between, I used, and sometimes I use also this from Dabur, since I have seen them preparing it. But again, I tell you, it is our pseudo satisfaction when it comes to Giloy Sattva. Giloy Sattva is entirely starch. I challenge anybody from the audience. I will give you 3 4 powders. You differentiate and tell me which one is Giloy Sattva. I want to see. Okay, it is not possible. Wherever it's possible, again, there is an error in the preparation. These days, many people do it using younger stems where you find chlorophyll and all. Younger stems are not recommended for making Giloy Sattva. That's why you get very few quantity. If you take 10 kilos, you get 10 to 30 grams. Many people complain. In the younger roots, you don't get starch. The root will be of this size in the forest. And the traditional Vaidyas who manufacture Guduj Sattva, they know about it. And the dose which I give again may embarrass you, but let me tell you, 3 to 5 grams thrice daily is the dose in which I am prescribing. Up to stage 3, I am able to manage them successfully. Stage 3, I have been handled for beyond 5 years. Usually, I say 5 years, but somewhere between 5 to 7 years, invariably, they are into dialysis. And you may ask then, what is the advantage? The advantage is they had extra 5 years life. At least 60, 70 cases I can show you with this thing. Only those who are having academic interest, I am ready to share my data for the physicians on a personal basis. Okay, nothing to hide. Ayurveda is being killed with this secrecy. I don't have any secrecy. I will share, but ethically, I cannot share all their details. Hiding there, this thing I'll give you, and with some of them, if you are seriously interested, you can go and interact. 1 and 2, they are surviving. There are many patients who do not have any symptom, and one lady, she is using right from 2007 till date. I requested her to stop medicine. She says no. Sir, I am live because I am taking this. Let me take at least one tablet, Bhumi Amla, thrice daily. She is taking. Last 5 6 years, just like that, she is taking. I said, okay, fine. Okay. Otherwise, my treatment for this is very simple. My follow-up period is nothing less than 5 years, and within 5 years, if I fail, I keep documenting it. And these days, I'm not handling ever since the protocol-based the dialysis process has emerged in India. 2008-9 onwards, I am not touching stage 4 or stage 5. Very rarely, in the known circle, when they want to consume something, I might have given. Otherwise, what is happening? Earlier, they were waiting for certain symptoms. They used to go for biochemical evaluation. Then they used to give dialysis. These days, dialysis is also protocol based. In how many days they have to do the dialysis and all. That's why I tell people, look, if you get into dialysis, you will not see your third year. Okay, so 2 to 2.5 years, invariably, at least I have not seen any patient surviving for 3 years after they start dialysis. So mostly that is the case. So in that stage, when I have taken up these 60, 70 cases and they have survived for more than 5 years, I think I did my part. I am not God. I did my part, and you people can try. I can guide you. Uh, absolutely no problem. But don't claim anything beyond that. Yeah, you can go to next one, because I don't make any claim of curing it. I claim I provide a better quality of life by increasing the longevity, and the quality of life scale longevity is the first parameter. So I'm giving you another extra 3 to 5 years. Yeah, I think we can go to next. Right. See, again, as I mentioned, this again, you are coming to my point only. Pakvasa Gatanadya. There is a link between large intestines and kidney. That's how it. Okay, whether the modern science established this fact or not. Okay, see, the excess protein is what is causing the symptoms, the swelling and all, whatever you are seeing there. Okay, and low hemoglobin. Low hemoglobin is obvious. Whenever you have deranged kidney function, you obviously will have. So in these cases, what I am also doing, I am also depending upon the interference. Sorry, this mm, what do you call it as situational amnesia. I am also depending upon the modern treatment. Let them take the injections and enhance their hemopoiesis, and through which the hemoglobin level will all go up. But for me, at least it will take 3 to 4 weeks if I have to give them the relief. Okay, so it is a kind of mixed approach, and I am not giving any of our iron preparation, friends. I am cautioning you: don't trust the pharmacies these days, including CCRAs. You ask CCRAs. CCRAs could not get proper Loha Basma sample even today. That's why the monograph is just lying there for the past 10 years. Ever since there is a ban on the excavation of this, digging of this, your hematite and other ores, outside you are not getting this ore. So they are taking the iron scrap available in the market and they're making Loha Basma. Friends, it will be full of tungsten or lead, tin, whatnot, everything, because most of the metals are made for a specific purpose, and they have, though they claim steel, they will add one or the other metal to that. Therefore, the metal Loha Basma, what you are expecting, will have multiple what we call metals which will damage, and it may be chromium. Who knows about it? So, my suggestion is either you prepare by getting hematite. For you, the samples can be arranged half kilo, 1 kilo. and that's how we traditionally used to make loha basma, and some traditional people are still making it with small quantities. But whereas for the pharmacists, no pharmacy in the country, I challenge, I give them 100 crores. If anybody is ready to take up this challenge, I want to be on record. So, friends, please don't give Loha Basma to these patients who are suffering from even your Pranava Mandur and all. People may speak high. Even Pranava Mandur is to a great extent is okay if you manufactured. Otherwise, people are using only the uh, metal which is available in the scrap stores, and they are purchasing and they're making Loha Basma. So be careful when you want to enhance the hemoglobin. Okay. Next, please. Very simple CKD, as you know, you have to restrict potassium. Very importantly, potassium. See, potassium once it is 5.5. There are subjects who have 8, 10, and up to 13 creatinine levels I have handled successfully. When the potassium is around 5, 5.2 and all. Whenever potassium is 5.5, irrespective of their creatinine levels, please ask the patient to go and consult a nephrologist, have a fistula in place. If your medicine is not going to work further, he should get into dialysis immediately. That is the last 10 years, what you call, simple thumb rule I have with me. Therefore, we don't do any injustice, and you have to restrict the protein diet, you have to restrict the salt diet. Okay, so these are the few things which will enable these people to manage their fluids, and fluids are to be controlled. So they virtually they will use a balance to balance their diet. See, nephrotoxic effects will always be there. See, look at Naga, Vanga, Yachda. In Rastarangani, if it is properly made, they have indicated in Prameha. When it is improperly made into Basma, they said it will cause Prameha. That means they know the nephrotoxicity of these metals. And even for this mercury and all, they have mentioned the Naga dosha, Vanga dosha, Saptaganjika dosha, everything they have mentioned. They have not hidden anything. They humbly mentioned about the side effects. Only thing, either we prescribe it in very excessive dose or very low doses. See, I'll tell you, in my observation, I have done on 10 formulations, uh, simple exercise. At any given point of time, is there any excess dose taken by the patient or given by the physician on the basis of the weekly probable intakes of heavy metals? JACFA is associate of WHO, which defines heavy metals in the foods. Today, unfortunately, we are looking at heavy metals as what should be in the modern molecules. Your 5 ppb, 6 ppb levels are out of question, out of context for natural products. For natural products, the JACFA norms are applied. I challenge any toxicologist. Come and show me one case when a properly prepared bhasma given in the dose recommended in Ayurveda text causing problem. Never it is reported. The malicious attempts are being made to defame Ayurveda, and we are also innocent to a great extent. And we are also trying to be smart in many cases. Our own community makes use advertisements, whether the commercial community or the academic community, for want of a degree or want of canvas. We are blaming, rather projecting Ayurveda products are 100% safe, 100% cure. Okay, So this 100% is something which is irritating the modern scientific community. Friends, let us first correct ourselves, then tell them, look, we have corrected, now you correct yourself. Without correcting ourselves, we cannot avoid this, what you call, criticism. I am also going to be among your community, and I have to live with similar criticism, because we are not telling them the truth. Nagabhasma is known for the nephrotoxicity, and it is there in Rastarangini. Who said it is not there? Okay, in the given therapeutic dose, you take one single formulation, calculate as per the text. We are giving only subtherapeutic. I feel ashamed to even mention the dose of Arogyavardhini we are administering as subtherapeutic. The total batch, you please look into 29th chapter of Rasa Samuchaya and Arogyavardhani. The total batch will be 320 grams. These 320 grams, it is mentioned Mandala Savita Shesha Rajakola Pramanataha. One mandala is 40 days and is to be given Rajakola. Rajakola is somewhere between Kola and Karsha. So it is about 7.5 to 8 grams. Your 7.5 to 8 grams into 40 days is about 320 grams. So your dose is 7.5 grams, and you are hardly giving 750 milligrams a day, or maximum 1 gram a day. Still it's working. So even if I have to call it a subtherapeutic dose, it should be somewhere near the therapeutic dose. It is not even nearer to the therapeutic dose. Okay, therefore many times it is not what you call showing any result for kushta, but it is as off-label indication or at a different dose level, it is useful in our liver disorders. That is the only explanation I can give as a pharmacologist. No, I did not manage even a single case. As I mentioned to you, people used to come, but see, the one who knows about his weakness will be more successful than the one who knows about his strength. Always knew my weakness and I avoided. So rest was successful. You should be very careful when you want to administer rasaushadis to manage kidney disorders. Okay, I still give. I don't want to say no, because in our traditional practice, majority of the formulations are rasaushadis. Okay, even Vasant Kushmakar does rejuvenation. So we use, even in diabetic neuropathy, some cases we use, extreme cases where nothing is working, we have used and we found. But again, that is manufactured in our vicinity with our resources, where our confidence levels are high. That is one thing. But we should be 200% careful when we want to administer rasaushadis in the kidney. Whatever it may be, if it is you, feel like if it is you, will you take it? If you feel you take it, then give it to your patient, otherwise don't give it. That's how I practiced and I am practicing. The problem is when the filter bed is torn and multiple holes are there, protein is coming out, you want to load it with a heavy metal, as simple as that. However minute quantity it will be, it will cause further damage. So we have to show lot of constraint when especially we are handling the kidney diseases. I have seen people giving it left and right, but I have not seen any patient, any physician talking about 5 years, 7 years follow up, because you will never come to know what is the latency when actually this patient entered into stage 1 to stage 2, stage 2 stage 3, and then into the next stage. Okay, irrespective of all these things, if your renal parenchymal damage is extensive, you are 30, your creatinine is 1.2, and you are a female, still we consider it as stage 4. There the relevancy is not there for your creatinine. So these are multiple factors which will come into play a major role. This is a big question. See, recently I went to one college in near Goa. I forgot. Uh, there I mentioned, I met the Swamiji there. They have Ayurvedic hospital and modern hospital working together, and they have a dialysis unit. When I was in Chandigarh 2004 to 2007, every day I used to pay about 1500 rupees for the Siemens dialysis machine, and I used to have it in my hospital, not for the management purpose, but to explain the students about what is a dialysis unit. Okay. And how many of us have seen a patient carrying a peritoneal dialysis apparatus and living at home? Some people do that either because of lack of money or lack of what you call their mobility. Sometimes we do that, but the dialysis is always is a restricted life. Okay, and the longevity will be shortened for sure. Uh, in the early stages, let me tell you, maybe before 2007-8, I was treating. At that time, the protocol-based dialysis was not given. The nephrologist used to wait. Then mostly the general physicians were also, as per their specialty, they were handling kidney diseases. So they used to wait when to call the subject for the next dialysis. They used to look at the potassium, they used to look at the urea, and then creatinine, and then hemoglobin. Then they used to call, and symptoms again, whether pedal edema and puffiness of the face, and then they used to call. Okay, so over a period of time, now it's fixed. If I fix it every week, you come and go every week, irrespective of whether you require it. With this, what is happening? Slowly, whatever percentage of function that is there with functionality that is there with your kidney, it is forgetting, and just it is waiting for the machine to do its work. It becomes lazy, or just it doesn't work. And these days, renograms are also there. People are taking the support of renograms also. So maybe a team of nephrologists and Ayurvedic doctors, if they come together, and just not to give both the systems to same patient, what to be given and why to be given, that analysis is to be made. When I used to administer to even stage 4, stage 5, if they were undergoing dialysis every week, it has become a fortnight and 3 weeks, and it happened successfully. But gradually, some medical institutes started refusing these patients for their next dialysis. So it prompted me to drop. And the last 10 years, I have not more than 10 years, I have not touched any stage 4 or 5 subject. But definitely there will be improvement if we work together, then only. Otherwise, they are deprived of the dialysis by the medical institutes. See, once creatinine is controlled, urea also controlled. See, they go together, na? So they are all representatives of the protein only, na? So that will also be controlled. Give low molecular weight proteins and very little quantity. No animal protein. That is, non-vegetarian diet is to be restricted, and not only that, milk is also to be restricted. And your masoor dal or moong dal, who are low molecular weight proteins, can be given in little quantities. Okay, and that's it. It will help.
Thanks a lot, sir. It was a very interesting and informative part. As representing from Department of Postgraduate Students in GMC Mysore, I would like to express my thanks, sir. Thanks a lot for giving such a wonderful experience. And the topic on the kidney disorders actually it is very novel, and management you have came across it different kind of mode of managing through the Ayurvedic drugs, and you have discussed about the toxicity and the concerns that we Ayurvedic fraternity would be facing. And thanks a lot for the lecture, sir. Now I would like to welcome Dr. Sanjay Kumar, MD, Professor from Department of Kaya Chikitsa, to have us to speak about us a few words about the sessions and to give word of thanks, sir. Thank you.
Namaste,
Hi,
sir.
Dr. Sanjay. Hi, Dr. Sanjay. You
Fine,
are
sir.
Mr. You are like Mr. India to me. You are audible, not visible.
Is it, sir? I'm not visible? Okay, okay. Just see why it's not visible. Now, sir? Am I not visible now?
No, not at least not for me. Maybe others. Maybe. Yeah, no problem.
Maybe,
You can continue.
maybe it's a technical error, sir.
No problem.
Thank you, sir. Thank you for such a wonderful, motivating, very unique and authoritative session. I heard you in different platforms also. Uh, Maybe that Draveguna based, I was very impressed with the enormous depth of knowledge you have in Draveguna and interpreting it with modern pharmacology, pharmacokinetics, dynamics, and all. That's why I just wanted to hear you, especially for this particular webinar on Draveguna, how the approach will be more interested. And I'm very satisfied. When I contacted you, basically be very busy. I was in ambiguity whether you'll accept or not. So first of all, I would express my gratitude for accepting to share your experiences on this platform, sir. And our postgrad, most of the students who are on this platform are postgraduate students, and not just having prescriptions was sufficient for them. It was more so of a basic concepts how we have to approach or how to select a drug with respect to Ayurvedic pharmacology and what actually comes out in modern. You have explained it with very well with an example of Punarnama, where we generally think that Punarnama is a diuretic, but it is basically an anti-inflammatory drug rather. That was such an examples were very good, sir. And even the basic part of understanding Vrukka Roga with respect to Srotas, taking consideration of Srotas, Basti, etc., the basic applied anatomy and physiology that you have briefed before this particular session was very important to just understand the further pharmacological events that medicines that you explained. And we had the doubts basically we had were the doubts of everybody. I feel as a practitioners, we will be in dilemma with the more superior super specialty people operating at one side and the patients coming to Ayurveda to see miracles. Most of the time when they come approach our hospitals, they'll be in 4th stage only or near to dialysis when the other nephrologists are dialysis they come. So we had doubt that how to approach and all, when to start medicine, whether to go alone with medicine or with dialysis. Such doubts were there, and you very well explained with very simple medicines and concept based how we can approach and all. So it was really useful sessions for us, sir. Not only for the students, I feel for all practitioners, this session was useful. So we'll be looking forward to many more sessions, sir, because I think the core area of your subject we haven't touched that. Probably that particular part, everybody, even in our department, they want to hear you, especially with respect to your core part of pharmacology and understanding Ayurveda, modern Rasaguna VRUKKA. Last time you were explaining about secondary metabolites, like why, how drug works and all. Those are all actually needed for present generation in a depth analysis. So I take this opportunity once again to thank you, sir, for sparing your valuable time. And I also thank all other staffs, students, postgraduate students from different other medical colleges who are on the platform or utilize this particular opportunity also. So once again, I'll thank you wholeheartedly, sir.
Namaskar.
Namaskar.
Thank you, sir. Thank you once again. So by this, we came to end of this today's session. By tomorrow, we'll be having Dr. Manish Patel, sir, to listen to his views on Samprapti-based management of various kidney disorders case study. So stay tuned till tomorrow, 2:30 p.m. afternoon. Thank you once again.